Good morning. This is Dr. Badia again with another episode of Fixing Healthcare from the Trenches. This week we have another young colleague who's actually in his training. Dr. Zachary Goldstein is an orthopedic surgeon, trained in Indiana. He's an Indy boy all the way, so I'm sure he's pretty good in basketball. And he's doing his spine fellowship at a very prestigious place in Michigan, William Beaumont Hospital. A long reputation of spine surgery. And we are going to be talking about, his generation of surgeons as they're going out now into this increasingly complex healthcare system. And what's unique about Dr. Goldstein, who should join us now, is that he is educating patients, because I think that's the key thing about our system. He's doing it largely through humor. So at the end of the podcast, make sure you follow him. And one of my favorite videos is where he's his daughter, who's we'll ask him now. She's quite young, very very precocious, and is complaining about things that surgeons say in the operating room, and it's just hilarious. So you can search for it on his site. But again, I think what attracts people is humor. And at this point in healthcare, I think doctors, nurses, techs have to have a little bit of humor, but that doesn't mean we have to stop fighting. So Dr. Goldstein, welcome to our weekly podcast.
Thanks, Dr. Badia. Thanks for having me. I just want to add, I've never really been tall enough to make it to any basketball team. So that's why I chose medicine. And I'll be honest, as we all know, it's really no money in medicine these days. So, I'm hoping my ticket is going to be my daughter making it big in Hollywood. So I'm just kidding. But
it's interesting because you're going to spine surgery, which is still one of the areas of orthopedics that can be, well compensated, as it should. People don't realize you do some of these cases. I remember as a resident, you're standing up and it's physical for 8 hours. And if something doesn't go right, which in anything in the world, nothing is 100%. If something doesn't go right, there's a lot of stress, right? So in the end, you deserve to be well compensated for that. You're going through long training, so I'd love to hear your perspective on your training and what your thoughts are for your future.
Yeah, I've loved my training. I've done my medical training at Indiana. I've had really good experience there. And now it's interesting seeing, a different location, different hospitals now for fellowship. And I'm going to be starting practice soon in a couple of months, going back home to Chicago, actually, where I'm from. I think this is a really, critical time for healthcare, just because there are so many challenges that we're facing now. And I think, the recent pandemic sort of just, accentuated these challenges. But, staffing challenges and burnout amongst, hospital staff is all relevant pretty much across the country right now. And you mentioned, my social media, I started it mainly for fun. But, I think it's important that, we find humor in what we do, especially given how hard everyone in healthcare is working these days. And then also, I think it's important for us to be self-aware of how we are perceived, as surgeons, nurses, staff in the hospital, because we need to be self-aware of this, because, even in jokes and humor, there's always usually a kernel of truth in any joke. So, if a surgeon may act a certain way, for example, and there may be a negative way in which they're perceived by staff, it's fun to joke about it, but it's also important to kind of be aware of that, so we can correct that and make for a better work environment for everybody. And so, part of what I've done in my videos is, I try to just find humor in just daily interactions, in the hospital, whether it's nurses or doctors or staff in general, for entertainment, but also hopefully to promote some awareness and some areas for improvement.
Well, I love the idea of self-reflection. The video of where you're fixing a fracture, or I should say your daughter is the surgeon and you are the scrub tech, which is the surgical tech, who's the very important person in our surgery, particularly in spine and also in hand. They're very technical surgeries, so they've got to know their equipment. really well. I mean, it's uh, and and I just had that scenario last week where I needed a reduction clamp, and the staff said, "Well, you managed without it." So I just had to chuckle because we can all relate to that, right? And it is a team. It's really like a symphony, and I'm excited to say I'm leaving. I got to be at the airport in about an hour, and I'm operating tomorrow. But I'll tell you, I'm going to give a plug to Gramercy Surgery Center. They are in Manhattan, and I've only done a couple cases there, and they're right on target. So I think the public needs to understand that all of these components in healthcare are really necessary for us to be able to take care of people. And I'm hoping, that's why I love the humor that you bring, is that maybe that'll get the public a little more interested, because a lot of what we do is perceived as being a bit boring, right? Although there's a pimple popper, right, who seems to be busted. I mean, I'd love to see people understanding your spine surgery, which is, personally, I think a little more complicated.
I don't know what it is about popping zits. My wife is a big fan of that particular doctor, but I don't think spine surgery will ever garner the amount of interest as popping a big juicy pimple does for the general public.
I guess, but the struggles you go through in order to be able to deliver that care, and let's talk about that for a moment. I mean, you are entering as you finish your fellowship and going to Chicago to practice. You are entering a climate where much of what you need to do for a patient, you need to be second guessed, and you need to have authorization by somebody who doesn't have a clue about this stuff, and it's not their fault either, right? I mean, I don't think any of us are angry at these people, but we are a little angry at the system, right? Why nobody is more qualified than you at this point, unless it's another spine surgeon. I'm certainly not qualified. If you order something or you do a certain procedure, you're not infallible, but you are the best person to make those decisions. So what are your thoughts about how we can overcome that?
Yeah, it's frustrating to see for sure. I'm not, because I'm still in training, I'm not involved with a lot of those calls, but I'm certainly seeing it. I'm in clinic with my attending physicians, and they're ordering tests for scheduling surgeries, and then patients are being denied for any number of reasons. Some are not justified, and then patients are frustrated because they can't get the care they need. Because an insurance company, for example, or someone has deemed it unnecessary, and it's
experimental. I love that.
Experimental, yeah. And it's definitely the case in spine surgery. I mean, there are so many procedures that you have to document everything so exact, and there are certain key components of things you have to document in order to sort of sell the surgery to whoever's going to be paying for it to cover it, and it sort of becomes a game in some ways. It's frustrating.
Yes, it is, and what I think is most frustrating for us as clinicians and caregivers is that the patients take it out on us, and they have to realize that we're in the same boat, right? We want to provide care. I mean, this is our profession. They need the help, and yet when they're denied, the patients often express their frustration to begin with, not just to me, but like to my staff, who really has nothing to do with it. They've got to sit on hold, waiting to speak to a person at a desk somewhere else in the country about a patient I'm seeing at that moment. That's very frustrating. So I'm hoping that the public who watches this, please channel that frustration to the insurance company or to your employer who decided upon that insurance company, so they understand that we are trying to help. And when they complain to us, it just adds salt to the wound, because we're in the same boat. So there are obviously a number of challenges in healthcare. So what would you say are 3 initiatives that you would like to see in order to really fix healthcare, at least make a dent?
Yeah, that's a good question. I mean, there are so many things. Where to start? I think one thing off the bat would be better price transparency. So you can't go to a drive-through and order a hamburger, and then get to the window and you ask how much it costs, and then they say, yeah, don't worry about it, and then you eat your hamburger, you come home and you get a bill in the mail 3 months later, saying it costs $1,000. If you had known it cost $1,000, you would have never gone to that drive-through. And so there have been recent changes. There's been legislation enacted as recently as 2021 that requires hospitals now to be transparent with at least some of the more common procedures they offer and kind of the negotiated prices that they've negotiated with the insurance companies. The problem is that a lot of hospitals are not compliant with these new regulations, and it's actually shocking. Some studies have shown that, like in orthopedics, for example, those compliance rates are even as low as like 20 to 30% of hospitals are compliant. And it's not even about being, having price transparency hidden somewhere in the website, but it needs to be, easily obtainable for patients. And I think if we started cracking down and making, prices more transparent, that would create an open competition. That would drive down prices and costs, and patients could be much more, educated and make informed decisions about where they're going to be getting their care.
Well, we're gonna try to get some legislators on here. Unfortunately, they're going to be also clinicians, physicians, because they're the ones who understand it and care the most. But podcasts like this, and there are others, are really going to hopefully, awake some eyes, because for one, it's the hospital lobby, right, is very powerful. So there is a film called The Swamp. I haven't watched it yet, but The Swamp basically talks about how much of Washington's controlled by lobbyists, and the American public has to just say enough. I mean, healthcare is up to 20% of our GDP now. So absolutely transparency. So let's well, maybe I'd love to get Marty Macri here, who wrote the Price We Pay, where he talks exactly about this with big hospitals. So
and it's
that is really a thing.
Your hospitals that are the biggest offenders, the ones that are classically ranked as, the top ranked hospitals in the country. Those are the ones that sometimes are the least transparent and actually charge the most.
Yeah, I have to be careful. I'm going back to New York, to my roots, so I got to be careful. That's a problem. A lot of physicians, even me, right, are a little afraid to speak out. But enough is enough. We really do need to explain. So, all right. So, initiative number 2.
Initiative number 2, I think, and this is a more recent issue, but just the staffing shortages in general, it's crippling hospitals.
Oh yeah. And surgery centers, you'll see when you get out there, even my surgery center. So.
Yeah, and nurses, techs, janitorial staff, everybody's been leaving the workforce in droves. Some of them are choosing to travel for better wages. And the cost of turnover and training new people, hiring traveling nurses, that is a huge, tremendous cost. And staffing shortages, lead to surgeons being able to or not being able to do as many surgeries as they want. And so the end result affects patients and patient care. And so healthcare in general, hospital, surgery centers, they need to find better ways to really retain employees, nurses in particular, because nothing can function without them. And so, obviously higher pay would keep more people, at their current jobs, but it goes beyond pay. You need to create a better work environment for people in general. People are being stretched too thin right now. There's burnout in the hospital.
Less bureaucracy. Use the word burnout. One of the things I mentioned in my book, Healthcare from the Trenches, I think in chapter 12, it's the title is actually moral injury. I hate to use the word burnout, because if you think about how hard you, particularly during your surgical internship, how hard you worked, and you managed to do it, right? So burnout is a little different. This is where it's akin to soldiers who've trained and they're able to do it. But when they're told you got to go into this place and kill these innocent people, that causes a moral injury. And when we don't get the authorization for that patient, or we're hampered with our care, and it's not just doctors, other people are feeling it too. So that moral injury takes a toll. So I agree. Staffing is a big one. So number 3.
Number 3, I would just say would be ways to improve efficiency and cost. And I think surgery centers are a tremendous opportunity. It's happened over the past decade, the steady move towards doing more procedures in the surgery centers as opposed to the hospitals. Not every procedure, not every patient is right for an outpatient procedure, but certainly ones that can benefit from an outpatient surgery. Oftentimes surgery centers are running at, more efficient and cheaper costs than the hospital settings. And I think we're going to continue to see more and more surgeons bringing their surgeries to the ambulatory setting, and that will continue to hopefully decrease medical costs and utilization.
Well, get ready. Your spine surgery has changed radically, as you know. We have now 2 spine surgeons who come regularly to our center, which is literally down the hall. And I invite you, Zach, to come visit and maybe even spend a day with one of those guys. He trained in the Midwest, and he's done some front and back. So for patients to understand what that is a general surgeon comes in, he helps the spine surgeon open the abdomen, approach the spine from the front, right? And then they turn the patient over and instrument the spine from the back, right? So we're doing that in our surgery center outpatient. Think about the cost savings of that compared to the hospital. So hopefully the insurance industry is listening, because, and they'll reach out to Dr. Goldstein in Chicago, who's recently trained and knows how to do these surgeries. So I agree. That is a big one.
Absolutely. And I got to take you up on that offer, because I got to get out of the Midwestern winter.
We'll try to come visit us before March or April.
Absolutely.
Set that up. So I'm going to tell you my 3 initiatives. They don't change, although I agree with everyone you said, particularly the last one. Everyone who knows me knows I'm a big proponent for outpatient care. Obviously for hand, but now we're seeing it in spine, and we're doing total joints as well, hip and knee replacements outpatient. So my first one is related to that, is see the right clinician at the right time. Okay. Seeing the right type of physician or even, mid-level provider at the time that you need it saves a lot of money, because you make the diagnosis earlier, you do the treatment plan, and that saves money, and obviously is good for the patient. The second one we touched on is, let's have oversight, not authorization, meaning we're not infallible. Obviously, there are bad apples everywhere. There may be physicians who say order too many tests, or maybe do some surgeries when maybe it's not 100% indicated. So that oversight is fine, but don't interfere. So let's get rid of authorization completely. Let's just get rid of that. And then the third one is what we're doing, and what I love that you're doing through humor, is educating the public. So whether it be podcasts or even we do a lot of live surgery. Every 2 weeks we do a live surgery. Hashtag Live Surgery Tuesday. So on Tuesdays you can see that, and that is a way for the public to get engaged. But I love humor. That's why I had you out here. So I did not tell you that I'm putting you on the spot. If maybe you have a joke or something humorous to share with us, or maybe something that happened that you found very funny.
Oh, I don't know. I'd have to think about that. We had one of the surgeons had a good line the other day. Yeah. In surgery, we like for the blood pressure of the patient to be a little bit lower, so it was a little bit bleeding. So there was a little bit of extra bleeding in the beginning of a surgery, and he turned to the anesthesiologist, and he said, "What's the blood pressure?" And the anesthesiologist said, 160 over 110, which, for those watching, that's a little bit high for surgery. And so he responded very quickly. He said, "That's what my blood pressure is about to be if you don't get that bleeding."
That's great. That's great.
I thought it was pretty funny.
And our anesthesia colleagues get it, because they know under stress. They're under stress, but only about 1 or 2% of the times, right? But they get it, and we work together, and that's what healthcare is all around. And I'm sure that the scrub tech and the nurse circulator probably chuckled, and probably the fellow helping clean the room and turn over. So
I was laughing under my mask for sure.
That's great. All right, well, Dr. Goldstein, thank you so much. Keep those funny videos coming, and with that intent of educating the public of what we are facing really from the trenches. Thank you.
Absolutely. Thank you so much for having me.
Thanks.